Jill. My name is Kimberly and I'm a student nurse from Southwest Tech. Your doctor just ordered an antibiotic to be administered, ceftriaxone sodium. Is that okay if I go ahead and do that? All right, perfect. Can I get your name and date of birth again, please? Good. Any allergies I should be aware of? All right, perfect. And I'm gonna wash my hands. Again, the curtain is closed. No PPE needed. Checking the doctor's orders, and he has ordered that antibiotic to be administered intravenously. Checking the MAR, that's good. All right, everything here. All right, and then some quick information about ceftriaxone sodium, also known as Rocephin. The safe dose is 1 to 2 GM every 24 hours. Indications: it treats serious lower respiratory tract infections, urinary tract, skin structure, bones and joints, abdominal infections, and we're giving this to you today for pneumonia. Dilution, we'll dilute 1 GM with 10 mils of the diluent, then further dilute with either 50 to 100 milliliters of the same solution. The rate of administration is 1 dose over 30 minutes. Precautions are hypersensitivity reactions can occur. We'll check your history of reactions to penicillin and other allergens that can be associated with, decreased prothrombin activity. Renal and hepatic impairment patients are at risk. And some side effects are hypertension reactions, diarrhea, dizziness, headaches. We'll be watching out for those too. Related diagnostics are aplastic anemia, dermatologic reactions, oliguria, and stomatitis. And some antidotes. If you were to have a reaction to this, we would discontinue the medication, give you some fluids, pump some electrolytes into you, and give you some protein supplements as well. So that's some information about my medication. And my calculation for today, we are going to be giving you 50 milliliters over 40 minutes. And my tubing calls for, it'll be administering 10 drops per milliliter. So we will be giving you a 12.5 drops per minute. Yep, okay, that's my antibiotic. And I have my tubing and my antibiotic here. My tubing is intact, hasn't been opened, it's new. It'll be used for the first time. Expiration date's good on that. And my expiration date and integrity of my antibiotic is good. We're going to be doing the first check of my MAR here. And ceftriaxone, good. Ceftriaxone, that's good. My second check, ceftriaxone, that's good. Ceftriaxone, that's good. And my 5 rights of medication administration are the right patient, the right time, the right route, the right dose, and the right medication. And I'm just going ahead and seeing that your IV is currently running, it's active. I'm looking at your site here, and I don't see any signs of phlebitis, any redness, tenderness, swollenness. Does it feel okay, Joe? Okay, good. And there are no signs of infiltration. There aren't any cold swelling patches or anything like that, anything hard. It's going directly into the skin, nothing underneath. Or it's going directly into the vein. It's not infusing into the skin at all. So it looks good. And that was put in a little earlier. Now we'll go ahead and I'm going to apply some gloves here. Wash my hands again. I'll go ahead and open up the medication. It's open. And open up my tubing. And the first thing I'm going to do is I'm going to close my clamps on my tubing. Good. And I'm going to start ahead. I'm just going to go ahead and lower my bag here. All right. And I'm going to go ahead and attach. Again, using aseptic technique, I'm removing this cap and taking this one off. Under the cap is sterile, and I'm putting on thumb to thumb technique. Pushing that in. That is good. And I'm going to go ahead and put this up here. And my first port, I'm going to go ahead and clean this with an alcohol swab. Rubbing continuously for 30 seconds. Okay. 1, 2, 3, 30 seconds. All right. And now I'm going to remove this cap. I don't want to touch the end of this to anything because it's clean. I'm going to remove this cap and place on there. Right. And right now this line is full of air, so what we're going to need to go ahead and prime this piggy bag here. So I'm going to go ahead and I'm going to lower this below my primary bag, and I'm going to open up this clamp and fill until it's about halfway, making sure there are no air bubbles. Good. Go ahead and close that and hang this above here. That looks good. Now we'll go ahead and open this so that I can infuse into the main line. And I'm going to go ahead and regulate my antibiotic here. Again, we said the drop factor was about 12.5. So I'm going to go ahead and watch that drip. So I'm going to open up this main with my main port here. And I'm going to watch the clock up there, and I'm going to count 3 drops for approximately 15 seconds. That's a little slow. I'm going to speed that up a little bit. Fast. Alright, and then that looks good. So that should be about 12.5 drops per minute. Alright, and then I'm going to go ahead and label my tubing here with a piece of tape, noting the date, the time, and my initials. And I'm going to put that up here on my tubing. And I would document my findings with that. All right, and then I'm going to verbalize how I would take off an IV site. I would clamp everything, make sure everything's clamped, and I would, holding the IV site, I would remove, first I would make sure that there's a towel or some sheet underneath here, and then I'd take off the top tape, and holding the IV site in place, I'd grab a sterile gauze and I would hold that and apply pressure and remove the IV, and then hold pressure for 1 to 3 minutes, so 2 minutes. I would count out 2 minutes, and then after 2 minutes I'm going to grab a brand new sterile gauze and I'm going to replace that on here on the site, throwing the old one away. And then I would go ahead and tape down a new gauze. All right, and then I would document that I had taken out an IV site. Jill, is there anything else that I can do for you today? I have time. All right, thank you.